I'd like to call our February 24th, 2026 Roanoke County School Board Budget Work Session to order. Madam Clerk, will you please call the roll?
Dr. White?
Yes, ma'am.
Mr. London?
Yes, ma'am.
Mr. Greenaway?
Yes, ma'am.
Mr. Hudson?
Yes, ma'am.
Ms. Clemens?
Yes, ma'am. Item 2.01, 2026-2027 Budget Work Session Number 2, Ms. Susan Peterson.
Right, good afternoon, Madam Chair, members of the board. Thank you for setting aside time today to go over our second work session. Real quick on our agenda, we're going to take a look at health insurance. Then we'll dip into compensation. We'll take a quick look at state revenue. It's not complete. We only got part of the information from crossover on Sunday, but I do have some data to share with you. We'll take a peek at kind of where the county revenue stands right now with some additional comments about that. And then we have a succinct priority list by department, including the tiers in your packets. And we'll go over some of the ads that have occurred, changes in numbers, cleaning some things up. So before I get started, I'd like to introduce Mr. Sam Irby right next to me. He is from Innovative Insurance, and they were hired to help us with our insurance consulting going forward. We do have some of his team online, and Steve's supposed to be up there too. Do you see Steve?
I don't see him yet.
He's still stuck in the airport.
There he is. So our actuary, Mr. Steve Parsons, is also online. He's got part of this presentation. He would have been here, but, you know, a rodent at the earlier part of the month predicted a longer winter, and a blizzard kind of kept his flight from coming in. And so we get to have him online as opposed to in person, but he was going to be here. The airports are not a place to be right now, evidently. And so let me go ahead and get swapped to their presentation. And if you want to go ahead and get started and introduce yourself.
You want me to introduce myself?
Mm-hmm.
I'll be happy to. My name is Sam Irby. I'm one of the partners of Innovative Insurance Group. We have offices in Roanoke, Lynchburg, and several places throughout the state of Virginia. We have been in this business for many, many years. I won't bother to tell you how many. Very happy to work with y'all. We work with a lot of municipalities and schools throughout the Commonwealth, and hope we'll be able to help y'all in some ways and share some information with y'all that may help you work to help your employees have health insurance and have good benefit plan that'll work for them going into the future.
Okay. And then, Steve, if you want to get started.
Yes, absolutely. I am not seeing the screen if you're sharing.
We're on.
Yeah, there you go. You should see it now. There you go. I have it memorized, so I can't go through it. You should see it now. You should be seeing the screen now, the presentation now. I am not. I am not either.
Who's the one manning the WebEx?
Yeah, we're pushing it right now, so it's coming out through our camera feed. You should be seeing this completely right now.
Is the PowerPoint on your laptop or is?
It's on mine. He couldn't do the PowerPoint on their laptop. He had to do it on.
I don't think he can share your
So that's
screen.
the disconnect. But he should be sharing that screen.
They should be seeing us right now.
We don't.
What are you guys seeing currently?
I see a screen that just says Karen Hawks in the center, and I see a picture of Steve, but that's all I see.
Try that.
Oh, there you go.
Okay, there we go.
Find the right button.
Awesome. Perfect. All set? Should I go?
Yep, you're good to go.
All right. Well, good afternoon. I apologize for not being there in person. My preference is to be there to have more interaction. With that, Sam's going to help me navigate. If you have questions, still let me know. Brief background on myself. I am a healthcare consultant, and I helped build two consulting practices, and we sold those, and I'm now in what I would call my legacy phase as a healthcare actuary, in which I'm doing exactly this type of project where I can come in as an independent actuary and provide insights, data insights and data strategies to help you manage your plan. And I appreciate this opportunity. We received data on February 6th of 2026, so we are quickly absorbing the data, and today we will be touching on the tip of the iceberg. Subsequent to this, we will be continuing to work with the data, data analysis, and work with Sam and his team on data-driven strategies that will help you then align the right partners with those strategies. So that's my role in this process. I have 2 or 3 worksheets that I'll share with you in this presentation. The one is telling the history. The second one is telling the why, which is the high cost claimant. And the third one is the actuarial forecast. I would encourage you to ask questions as I go through this. Please don't hesitate to ask those questions, especially if I use lingo or terminology that you're not familiar with. And then following my slide, Sam will then tell the how. How do we manage this going forward? So with that, we'll go ahead and go to the next slide. So this slide is really meant to empower you as a board and as administration to start to actively manage your plan. Yes, being self-insured does present savings of 10 to 15%, but being able to pursue best practices and opportunities that will also deliver not only savings for the board, but most importantly for the plan participant. So those are that's the why we are self-insured. Yes, the savings, but the real opportunity is empowering you and your consultant to put in processes and vendors that best align to help manage the plan. Below, towards the bottom there, we'll also work with with Susan on developing a written funding and cash balance policy for the self-insured policy. That will allow you as a board to understand why we're setting the premiums at the levels we are and why we are maintaining reserves at the levels we are. It's a document that is valuable because it helps eliminate some of the noise and politics on why we recommend what we're doing and why you establish those reserves and funding levels. All right, and ultimately, this process will help you fulfill your fiduciary duties and responsibilities. So this table is pretty busy. It has on the top portion the last 3 years of calendar years of claims information that was used to project our funding for 2026, 2027. So you'll see going across from 2023, we had medical claims of 13 million, drug before rebates of 6 million, so a total spend of 19.2 million. And then Anthem charges a network access fee, and those are estimated for this purpose. To the network access fee is their fee to maintain the network, negotiate with the providers, on your behalf. And then stop loss, that is actual stop loss reimbursement over 250,000. So you were not responsible for those. And I'll highlight that in a second. And then because you have your prescription drug program carved in with Anthem, and I'll use the term carved in and carved out a few times here. They provide prescription drug rebates to cover your administrative costs. Going into 2027 fiscal year, it's going to be $125 per employee per month. Last year it was like $120.37, if I recall correctly. So they are increasing them going into the next year. But going across that, we have net claims of 17.5 million for 2023. And then there's a big jump to 2024 of 20.4 million, and it's maintained itself at 21.8 million for 2025. The next slide will tell us the why. But if you go back to the left and under the medical, you'll see under medical, your claims were 13 million, then 6 million, and then 16.6 million. There was some discussion at last year's work sessions whether that was a temporary spike in 2024. Some often use some often will describe every 5 years you're going to have a bad year. As we discuss the next slide, I think it's probably the new normal, and that we should plan for it to be the new normal. As you can see, 2024 was 15.5 million, and then 16.5 million in 2025. And correlated to that, your stop loss reimbursements also increased at 944,000 24 and 1.5 million in 25. I'm going to pause and see if anyone has any questions. Okay. The other purpose of this slide is actually at the very bottom right, and you'll see 11.4%. That represents the average healthcare inflation for your plan for the last 2 years, for claims specifically. That does not include administrative costs, which our third slide will. You'll see above the 11.4% in the increase from 2023 to 2024 was 16.2%, and then from 24 to 25, 25, it was 6.9%. I calculated in the actual annual rate, and that was 11.4%. That is consistent with what I'm seeing in the marketplace. So this discussion that we're having today is not unique to Roanoke County Public Schools, in my opinion. So as a freelance actuary, I've for the last 5 years, I've been working with a good number of groups, including a couple in Virginia and a couple in California, and then in the middle with Kansas City, and quite a bit in Ohio, where I'm located. The trends appeared to occur in 2024, and I'll get into it on the next slide when we talk to high cost claimants, why I believe that's the new normal. I hope I'm wrong. This is being recorded, so we'll be able to look back a year and see. I don't want to be wrong. I mean, I'd like to be wrong, but I also want to give you good information so you can plan appropriately. Okay, go to the next slide. All right, this is the why. There are 3 columns here: 2023 calendar year, 2024, and 25. If you go to, for all claims over 250,000 in 2023, it was 1.3 million, 24 was 2.4 million, and 25 was 3.5 million. You have specific stop loss that protects you on those claims over those amounts. And the negative red there is what Anthem Reinsurance paid on your behalf for those large claims. if you go down to the next row, but you were still responsible for 4 claimants that hit 250,000. That was $1 million. In that following year, there were 6 claimants that exceeded 250,000. That meant Roanoke County Public Schools had to pay 1.5 million of those claims. And in 2025, you see that we now have 8 over 250,000 at 2 million. What I call little big claims is highlighted in the green. It's those claims between 50,000 and 250,000 under your stop loss. I actually coined this term probably 10 years ago, working with a large children's hospital in which they had 106% loss ratio, meaning they were 6% over their budget, but they had no stop loss claims. It was all what I, at that point in time, called little big claims. There's the little claims that are just over 50,000 up to your 250,000. This tells a significant story. And again, it's consistent with what I've seen with other plan sponsors. So in 23, it was 59 participants in that range at 5.4 million. Following year, which is our big spike, was 90 participants in that little big claim bucket, just under $10 million. 2025, which we just completed, you had 103 claimants in that range at 10.5 million. Below that are the claims between 25,000 and 50,000. You'll see that those have also jumped into 23. And total over 25,000, you'll see was 8.6 million, then 4.3, and then 15.6. I'm going to come back and point out a couple items, but I'll just finish reading this graph. Or chart, excuse me. Claims between $1 and 25,000. I had to estimate 23. That's part of where I need to get more data. I suspect that will come down, but it's 11 million there. The following year it was 8.4 million, and the following year it was 8.5 million. So the vast majority of your claims is not what's driving your increase in claims cost. It's the claims above 25,000, and specifically the little big claims. So why is this occurring, in my opinion? We had COVID, and hospitals and health systems had contracts that ran multiple years, and as those contracts, but at the same time, their cost of delivering that care was increasing as we increased the wages of the staff and nurses at those health systems. So their cost of delivering those services had increased, but they could not adjust their revenue for that until they renegotiated their contracts with the carriers. My assumption here is those contracts have been renegotiated, and has led to increased costs for us as plan sponsors and participants. And I call that lagging inflation. I'll pause and see if you have any questions. Okay. It's important to show this slide because, we can plan for this to be a temporary spike or a sustained spike or the new normal. In the next slide, we are planning for it to be the new normal as we set your fiscal year 2027 budget. Okay. So we simplified this slide. There's actually a lot more rows to it, but it was important to show you how we forecast claims and fixed costs for the 2027 fiscal year. How we do that is we look at 2 years of claims data for both medical and prescription drug, and then in total. That allows us to get to a per employee per month, which is on the 4th row there. In 2024, your PEPM was $794, and in 2025 was $828. And the note there is the claims include network access fees. And then prescription drug, the same exercise. And $370 to $409. Now that's before rebates, which you'll see the negative below, in which we take the rebates out. And not only do we have lagging inflation occurring, but we have prescription drug spend that is certainly above double digit. And as you'll see in the following row, where you see trended 7.5% and 10%, I'm assuming medical inflation of 7.5% for those claims back in 2024 and 25. I'm taking those old claims and moving them into your fiscal year using 7.5% trend. And I'm using 10% for prescription drug. Prescription drug is certainly often the first place I look when I come in and do my actual forensics and helping groups determine what is occurring, so we can find data-driven strategies to correct that. With that, let's look at the medical columns again. If I only looked at the 2024 data and ignored the 2025, I would say your claims forecast for medical would be 18,471,000. And vice versa, if I only looked at 2025, I would say 17.9. We are blending those two together at a weighting of 30/70, as you see there. So our forecast for medical claims is 18,076,000. On drug, I often weight the most current year 100%. In this case, it really didn't matter because the two were only about $20,000 apart. There'll be situations where I see a much wider spread, and prescription drug runs a lot truer for the most recent 12 months. For that, I'm projecting 9,156,000. So total claims projection is 27,233,000. We did not do a claims load. Often underwriters or actuaries may say, based on what we're seeing with your demographics in your group, we suggest adding a 5% load or something like that. We're sensitive to employees' cost share on this, so we used 100%, and thus we have the 27.3 million. Now we net out the 2.4 million in rebates. That's the $125 per employee per month, estimated to be 2.4 million there. You will receive additional rebates above that, but for this forecast, we are using an administrative rebate offset of that $125 per employee per month. And then that gets us to claims of 24,923,000, which is to the right there, next to the 2026-27 fiscal year. This ties to this previous slide. In 2025 calendar year, you had 21.8 million. So when we look at this as on a PEPM and I annualize the trend, the annualized trend is 9.8%. Then we have fixed cost of 500,000. That's the administrative cost that Anthem is charging. And we have Anthem's initial proposal at a 25% increase on your stop loss fees which would be 2,383,000. Total of all that, as you can read there, is $27,806,000. And that's what we're recommending for that portion of the budget. When Susan presents her budget, she'll be tying in other line items like HRA funding and consulting fees and other items. But this is the largest chunk of that budget.
So Susan, are you going to speak about like what percentages that would be for the 1,630 participants in your presentation?
Do you want to tell them the percent increase overall?
Yes.
For the employee.
The recommended increase is 22.5% when we bring those other items in, and then we compare it to your current funding level.
And we've broken that down. When I get into my slide, we've got two options right now. One, the employee shares in that percentage, and the other one, the employer is going to take over some of it, and we will only push out 10% to the employee. So we've got two options for you to
Well,
take.
and I think, and this doesn't involve them, but we have talked about this before in terms of what benefits the employee the most, right? Because the higher salary versus the insurance cost, the higher salary affects them with their retirement. Or we'll talk about that later.
That's right. Plus, so and maybe we're not getting into this yet either, but I'd like to know how our consultant that we used for the last, 6 months? Is that right? How, 3? Maybe. However many months. How you've helped us here as well.
Well, we'll get into that.
So we'll get into that. Okay.
We intend to try to help that a little bit, mitigate that for y'all. Mm-hmm.
You need me to get your other bag.
This slide simply repeats what I've gone through. Not sure we need to spend a lot of time on it. The important observation that I can share with you, I would tell you that with the self-funded groups that I've been working with for 2026 and now for fiscal year 2026, for those that are on calendar year 2026, my average increase was likely in that 11 to 14% increase, kind of supporting my other observations. And I had several above 20%. I don't like saying, you're with others in this, but, I think it's important to share with you that, in my opinion, as a healthcare actuary, there's clearly a trend here. And what this, the first self-funding slide is, there's so much Sam and his team can share with you, and I can share with you, that will help you manage your plan. While this is negative news, I hope there's good news coming, because there are opportunities for you, specifically on the prescription drug side, as low-hanging fruit, if you will. And then there's other opportunities beyond that. It's not like I'm coming to you and saying it's going to be recommend 22.5%, and hold on, because it's going to continue to be 8 to 10%. My message to you is it's 22.5% because we have to make sure the budget's in line. And as we get additional data and we get access to Anthem's data, we will, Sam and his team will be providing you with insights and opportunities, which is my handoff to Sam and his slides. Any questions before I do that handoff?
And I would like to remind everyone, this was a very slow process getting our new consultants. So just to share the timeline, we were kind of waiting for another procurement to go through, and that fell through. And so then we went out to RFP. And by the time we rushed the RFP to get this moving as fast as we could, but then the holidays kicked in. And so I don't think we had a signed contract until December-ish. So they've really only had the data for about 2 months. So I don't think, and coupled with that, we are already in plans through the end of the year. And I think that where they can help is starting going forward, right? Helping with changing some plans.
Well, I thought that's why we engaged them when we did, because we were going to get that maximum benefit. In fact, I'm trying to remember the language of, you give us 6 months, we'll pay for ourselves in 6 months. I'm looking for where we've paid for ourselves.
Still planning to do that.
Still planning to do that.
We're going to discuss that in a minute.
Okay.
Thank you.
Yeah,
yes, we're going to discuss that. I appreciate your question.
Yeah, thank you.
Yeah, that's where we're headed. You're right ahead of me.
Yeah.
Okay.
I remember some of those things.
Yes, sir. Yeah. So I appreciate the opportunity to be here and to work with y'all. And as Susan said, it's taken a little bit of time to get all the information from Blue Cross and everywhere that we need to get it, to take a look at everything. And try to understand the program that you were running compared to where you may want to end up for this July 1 and where you may want to end up next July 1 and going forward. So that's what we want to talk about for just a few minutes right now. The first slide that we put up are just basically some of the goals that I think most people share in y'all's position. And one is to minimize employee disruption any way you can. Normally, school boards, board of supervisors members, private industry, what you're trying to do is run a good benefits program that year after year after year, your employees are not raising their hand and say, why are you doing this to us? Why is it all this money coming out of our paycheck? Why are you downgrading our benefits? You'll see that the second thing says avoid downgrading benefits. It's really easy. We can set up a program to save you $1 million this year just by downgrading benefits, but that's not what you want to accomplish, because that's just throwing that responsibility and risk out on the employee. So we want to avoid that. We're in the process right now. We want to be sure that you're offering competitive benefit plans. I noticed here there's a section in your information about schools and counties around you. Certainly you want to keep yourself in a position to be able to hire employees and have good employees be able to reach people that you need to reach. So we want to be sure we're sensitive to that. Researching options to meet employee needs. As we do open enrollments this spring, we will be talking to your employees in person, and we'll be asking them, what do they need? What's working for them? What isn't working for them? To give us more insight into what to do in the following year as we go forward. One of the big things that I think we have always done is educated employees so that they do understand the benefits that are being offered to them, that they do understand that y'all are working hard, and the administrative team is working hard, Susan's working hard to keep it as good for them as possible based on the circumstances that are going on within the industry. I will comment before we go to the next slide. We are seeing a lot of high teen and low 20s renewals right now. I'm not sure where it's all coming from, partially still probably tied back to the pandemic. Steve talked about insurance companies and hospitals and providers renegotiating contracts, and certainly that's got a lot to do with it as well. So I think we may be in a situation, you're not alone right now. We've had some good renewals this year, but I've seen a number of them that are in this 15, 20, 25% range so far, and there are a lot of them I hadn't seen yet, so I'm sure that's will be forthcoming. If you could skip to the next one. What we try to be, I'm sorry, yes.
Contracts renegotiated.
I'm sorry,
How often are those contracts renegotiated?
Usually every 2 to 3 to 5 years. You think sometimes it's kind of forced, because a lot of times maybe ER physicians will say, we no longer, we want to change this. So it just kind of goes in cycles. Normally you think about a 5-year contract, but I'm not even sure there are that many of those going on right now. They may be shorter term than that.
Excuse me, Sam, the local contract with Carlon, and if I mispronounced that, I apologize. They negotiated a new contract and announced it in February of 2024, which could be coincidental with your claims type.
Did we lose you, Steve? Stop talking.
I think he was saying 2 years.
Yeah. I'm sorry. Go ahead, Steve.
The local health system in Roanoke renegotiated with Anthem and announced their new contract in February of 2024.
But you don't know how long that was, or how long that.
Yeah, I don't know how long that lasts. Okay. I don't.
Yeah, we don't know how long. I having worked with hospitals and health systems, it's actually a niche of mine. I would assume 3 years.
Yeah, that's probably most of them. Probably all. And all of that, what that basically is, as you know, the hospital all of a sudden for your hernia operation is getting another $50, $100, $1,000, whatever it may be, and and all of that, they just passing that cost right back to you, and it comes right back to you. So what we're trying to do right now, what we've been working on, as this slide is talking about, we've requested all of your clinical data from Anthem. And let me back up 1 second. One thing that is a little bit difficult is we don't have last year's renewal. And of course we can't get that from Anthem because y'all were with the county, and that's the county side of things. That means when they sent us numbers this year, and interestingly enough, the numbers that we got from Anthem as a renewal for y'all for July 1 match up really closely with what Susan and Steve have worked on. So those claims are right on target. As far as what the Anthem underwriter thinks the cost will be, what Steve thinks the cost will be is within just a few dollars of each other. So I think this estimate that you're seeing right now is pretty true to what probably is going to happen. Now, with that being said, that doesn't mean they're not things that you can do to try to help yourself, and that's what we'll address here in just 1 minute, Mr. Greenway. But we've requested that Anthem send us as much clinical data on the schools as possible. That will help us to see where these claims are coming from and to help point you in a solid direction as far as wellness programs and things you might encourage that will help mitigate some of those claims going forward. So that'll be something we'll discuss in a future meeting. We're also doing a review and reconstructing HRA, HSA contribution methodology that you're using now. Is that accomplishing what you wanted to accomplish? Could some tweaks be made there that would be helpful? We're looking into the cost of changing your accumulators. Right now, your deductibles and out-of-pocket maximums are running January through December. Your plan is running July through June. And to get that synced back up, there'll be a cost associated with that, and we've asked Anthem's underwriters to look into that and give us some numbers on that as well, so that you can make a decision. Is that something you might want to do? Fourth on the list, and I probably should have put that last on the list because I've got the next slide that's going to talk a little bit more about it, but right now y'all are not currently using something called a spousal exclusion, and many of the groups around you are using a spousal exclusion. We've used them for a number of years. A spousal exclusion, for those that don't know what that means, is it basically says if your spouse works somewhere other than the schools that offers health insurance to them, they're not allowed to be on the school program. So it's not going to hurt anybody whose spouse works here that doesn't have another option for coverage. It only affects the ones that do have an option for coverage elsewhere at their place of work. That is something that can free up a significant amount of money for you. You've got 442 spouses covered right now. You would probably lose 40% of those if you put in a spousal exclusion. And if that were to occur, that just in contribution, employer contribution alone, will save you over $600,000 this year in costs that we're looking at. That does not take into consideration what you're going to save on the other side of that in claims cost and all the little big claims, as Steve likes to call them. You've had numerous claims of spouses that are in that range that, you won't catch those claims anymore as well. So that one move in and of itself, and there's no way to tell about the claim side of it, but going into that may save you, $500,000, $600,000, $700,000 more. If you take 40% of them, 160, at what y'all are contributing towards the premium for them to be on your plan right now, it figures at $600,000. So that would be a significant savings that you could have there. We're looking at voluntary benefits. The reason for looking at that, as your deductibles have increased through the years, right now you've got a $1,000 deductible, a $2,000, a $3,400. As those deductibles have gone up through the years, what happens is the employees having to pay more, you're using HRA, HSA contributions to cover that. Well, there are voluntary products out there that critical illness, hospital indemnity products that employees can buy with their money to offset those deductibles, which in turn do two things. It makes them more comfortable with what they're looking at, because a lot of people that are employed here probably would not appreciate hitting that deductible this year and having to come up with $2,000 or $3,000. So they've got ways of purchasing things maybe to offset some of that, and certainly we'll be looking at all of that into the future. The dental part of it, you're in the consortium right now. We are getting some pricing together just to look at that as to whether that makes sense to come out of there. What we have so far looks like it would make sense to try to come out of the consortium this year. Would save you a little bit of money. It's not a lot of money because we're talking about dental insurance. Your RX analysis, we are currently having that done as well. Steve alluded to that a little while ago. If you carve out your pharmacy benefit management, the PBM side of it, which you got Carol on right now, if you carve that out, you very likely could save $1 million plus. So that pricing is being done right now. We'll take a look at that. Whether we can get that done by July 1, I'm not sure, but we certainly can do it by January 1 if you want to do it mid-year. And it's certainly something worth looking at. You may want to do it third quarter. We'll just have to see what that analysis looks like when it comes back. Repricing the reinsurance pricing. We're also trying to reprice the reinsurance a little bit to see if we can't get a little bit of traction out of that. You know, that amount of money, that $2.4 million, $2.5 million that they're charging you this year, they gave you they didn't give you. They paid you $1.5 million last year, and they want $2.5 million this year. There's not a lot of space there between those two numbers. Given the trending of your claims, there's not a lot of space there. But at the same time, you know, there may be $100,000, $200,000 there possibility. I just don't know until we get a little bit deep into it. But that would be for this July, hopefully. In your renewal, you have a wellness credit, which is, I think, by memory, I didn't write it down. I think it was $29,000 that you have available to you for wellness. In addition to that, Anthem also allows a universal credit to groups at times, and that may be something else that could come into play as I discuss the renewal with them and discuss what works for y'all and where you would like to take this year. So we may be able to pick up a little bit of money there. Your preventive drug options are always a great option that should be driving costs down as you move forward with that. And then we're just looking at the medical pricing all the time, seeing if there's something else out there that may be advantageous to you. So we're in the process of getting a couple of preliminary quotes to look at there just to see maybe another company comes in and says, we're going to save you X dollars. We'll just have to look at that and see if that's a possibility. You can flip side. I'm sorry, and I can stop. Don't want to take up too much of your time, but certainly want to answer any questions that you might have.
I cannot imagine how a spousal exclusion would be helpful to our employees' bottom line. How it could help their, I mean, it may help us save a little bit of money, but I'm not sure.
It's not saving enough for the damage it's going to cause for the employees.
Yeah, I mean, I can't fathom a way that could help a family's bottom line if a spouse and our employee have to have their own individual plans.
You're got a good point. It's a balancing act, right? So we're not the highest paid district around. I mean, this has nothing to do with you. I'm just for the crowd here. So we have to offer things like benefits, right?
Sure.
And so we got to figure out what benefits you to come work for Roanoke County. How can we keep you here at Roanoke County? We want to hire the best. We want to retain the best. We start stripping this insurance plan down to nothing, and we're going to lose some people. Bottom line.
Well, what we're talking about with spousal exclusion, excuse me, and I'll restate this. Well, I'll give you a good example from a few years back. I'd say a few, it's been probably 20 years ago, 15 years ago. Family machine business that I worked with, they paid 100%, no matter how you enrolled. Which family-owned coverage, they paid 100%. And a couple of years in a row, they said, you know, the increases were 10, 12%, I think. It was a hard market at that point. And they were saying, how do we change this? And I said, well, we can downgrade benefits, but I hate to see you do that. What you could do is say, okay, we're not responsible for the spouse. We're responsible for the employee, but if the spouse works somewhere else, we're not necessarily responsible for that. And I said, what you could do is change it around and don't pay so much towards adding the spouse to your policy. And they said, well, that's all right. We're a family-owned business. We're going to keep doing what we're doing. And right the second or third year when we looked at this, I said, well, look at it this way. If that machine shop that competes with you less than a mile down the road here, y'all compete for business all the time. What if I told you 10 of your spouses work for that machine shop? Do you still want to be paying their insurance for them? So what I'm saying to you is you've got a lot of spouses on your coverage that work elsewhere. And maybe, I don't know why they're on your coverage other than you're offering insurance to them and you're paying a larger share to have their spouse on coverage.
That's a common practice.
So it's something to look at. I'm not saying you want
Well, we're
to do
talking about $600,000. Now, granted, like you said, that doesn't cover what claims and things like that we would have. $600,000 off the top. Well, that sounds like a lot, but when you're talking about $27 million,
not that much.
That's not that much, right?
Well,
So we got
understand
442. Susan, you may know the answer to this. How many people we have on the plan that are couples working here that it wouldn't affect? And I don't think it's quite that many. 60.
They're in a different category, so I don't think they're going to be in the category.
Right, that's what I'm saying. So you subtract that from the 442 that we do have, you're still looking at close to 400 people that this is going to affect.
Well, it's only going to affect the ones that have the job outside. It doesn't affect your other spouses. If
Right.
They don't
So they still get insurance with the other company. They come off of our insurance.
Correct.
It is a common practice in the
very
business
common
world.
practice. And
I'm not saying
Well, and in the business world, you generally make more with a 4-year or
Yes.
6-year, 8-year worth of college too.
Yeah, that's right.
And that's
That's
a lot
right.
of it. I mean, you're looking at the majority, the backbone of this operation. The average salary is probably well under 100,000.
Right.
So a lot of that, I respect what you're saying because I've seen it in the business world a lot. I'm not saying I agree with it necessarily, but what I'm saying is it's worth looking at to take the measure to look at. I'm not saying I agree with it because we don't know the numbers to know
Yeah, we would have to
whether
know
we agree with it or not.
the numbers.
But if you're, for instance, another business was doing the same thing, paying, and one family had their children, which now you can go up to 26, 28, whatever it is, had their kids on the plan too because they were eligible to be on that plan and paying that 100%. Well, they were only on that plan because it wasn't costing them anything, and their business offered it to them, but they weren't going to get on that for the very same reason that it was no cost. So if you
Well, and it's bottom line is, yes, it costs a lot to have your spouse, but they're probably doing it for financial reasons because the spouse insurance is probably going to cost more separate than it would having it on our plan. I mean, because people are going to do what's financially smart. I mean, at least think they're
Sure.
going to do what's financially beneficial.
But if the other company offers it, usually they're paying for it now. Again, I'm not saying I'm for or against. I'm just saying
I just don't.
If
we
they
need to
pay
look at
100%,
everything.
That might make a difference. But let's just take, for example, the Key Care 1,000 RCS employee $740, employee and spouse $1,036. So you're going to tell me that for $290 an employee, a spouse could go out and get their own insurance for a month?
No,
No chance.
You don't go get your own insurance. The other company offers it.
Yeah,
But you're going to be paying more than $200.
you think they're not going to deduct more than $298?
I don't know.
So you
I
are.
don't. That's
oh man, yeah.
the point of the.
Maybe the best thing would be to see what the number actually looks like in terms of how many people would that actually
That's
affect.
right. That's what I'm saying.
We need to see the numbers on who would no longer be eligible. What does that number look like, and how much money is that really going to save us? I think
That's right.
right now we're operating in the what ifs. I think we just
Fantasy.
need to
It's gonna
see.
cost the employees more money
Yes.
if they have separate policies.
Yes, we're also trying to figure out how we're going to
The family more money.
help our own costs. So I
Yeah.
think we just have to figure out what these numbers are to see. We don't know anything until we look at what those
Well,
numbers
it's
look
important
like.
for the employees to know, anybody that's listening, because it's going to spread like wildfire. That we're going to do everything we can. We're not.
Yeah,
just
we
gonna
haven't changed.
spread
We're
it.
not changing
Right, we're just asking
anything.
questions
We're just
at this point, but I think
looking
we
into
need to see
options.
what the numbers look like
Yeah.
to
I
see.
feel like you have to just look at individual situations to kind of play it out, because like on paper, what would incentivize somebody? Like, for example, currently on our Key Tier 2000, I mean, the employee only rate is what, $93 a month. I'm looking at the back. Whereas if you add a spouse, it jumps up to $630 a month. So what would incentivize somebody who could get coverage on an individual basis with another employer to pay that difference? You know, so I think it's important to try to tease
that's
that
what
out.
we got. That's what
What's
we
going
got.
on with
Right.
that?
This gentleman.
And I, that's a great question. I appreciate you
Yeah.
asking it. I think there's several things that incentivize them. Of course, money is part of it. So certainly, if their place of work's going to charge them $500 extra, if it's going to charge, if the space is going to have to pay $500 at their place of work for coverage, and they can get on here for $400, they're coming over here. And another way to alleviate this, or to work with this, is to change what you charge or what you pay towards spouse's coverage. You know, there are a lot of different methods, and we'll look at all of those. Another thing that would encourage people to be on the school coverage, and we've seen this, is people do something 10 years ago and they never look back, and they don't change. They don't consider what their options are. And in this case, if you have a spousal exclusion, then they're going to look at it every year. And if the spouse stops working at wherever they're working, I don't want to call the name of a business, but if they stop working over there, they're no longer eligible. They just jump back on coverage here. Well, years ago, all of that changing around was a problem and a fear, because you worry about pre-existing conditions. And, you know, can I pick up coverage again? Am I going to have this pre-existing condition and have no coverage when I go from plan to plan? You don't have that problem anymore. So as long as you're operating within the qualified event status that the government set forward, then it's no problem to go plan to plan to plan to plan to plan. So, but a lot of people made a decision 5 years ago about where to put the space, and then never looked at it again.
Haven't addressed it again.
I assure you. And, you know, and another example I give you, if I worked here and my wife worked XYZ, wherever, and let's say she works for a company that's got 10 employees, and they offer health insurance, and actually their plan is better than my plan here, but I may not realize that because I'm not in the insurance business. And if my spouse has a health problem, where am I going to put her? On the 10-man group or on the 1,500, 2,000-man group? I know y'all's coverage has got to be better than what's out on the street, and that's not necessarily true. I can tell you from experience, a lot of those small companies don't have $1,000 deductible. They've got less than that. But people do something once and they don't look back at it. And that's one thing that we try to do during open enrollment is, what are your options? For you to be on here, your spouse or your kids, or you are in a situation where you could split your children up, or whatever the case may be. That's the ones that will talk to us, the ones, you know, that we see in open enrollment time. We'll be asking them all those questions.
Well, let me say it from our perspective. I know every one of us feel this way. Knowing what's coming from Roanoke County that we just got hit with, there's nothing in us that wants to see our employees lose any ground on their pay or their benefits, right? So I respect what y'all are saying. I'm just saying those are options to at least see where they come in at. You know, we're going to have obstacles that we didn't expect that, we should expect from this group, but not this group, but the group we deal with on our counterparts. But, so I think we look at every option. If it doesn't, it may not, I agree, may not be something, but I'm not for taking a step back for our employees. I fought for a decade to get them a raise every year. So, and to move forward, not where we should be, but where we can be. We've lived within the constraints of monies. We've lived within those constraints. Our counterparts don't. They just tax and spend and use that money. So we have to stay within the restraints of what we're given, right? So, but our employees shouldn't suffer because we have one of the best school systems in the state of Virginia. So we're the shining example in this region, in this part of the state. And so for us as a board, I agree with what your sentiments are, that we're not going to take a step back with respect to salary or benefits. We're going to keep forging ahead and doing the right thing for our employees. So thank you. And I just do agree that we ought to look at every avenue we can.
Yeah, and that's all we're doing is.
How do you go about doing it? What's your methodology as far as, do you survey like real people and try to find out what their situation is versus just dealing with the hypothetical? Because right now it's kind of hypothetical.
It is. And one thing, you don't want to spring this on the employee.
Right.
Okay. Because as I said to start with, we don't like disruption in employees because that only causes us more work because they're talking to us about it as well. Because everybody here will end up with my cell phone number and the cell phone number of employees. And, we will be helping them with claims. We will be helping them with whatever they need. So we like to keep the plans right like they are if we can. We like to keep the employee deduction right as it is. I asked an account less than 2 weeks ago to one of the boards, and I said, what we'd like to see you do is y'all absorb this increase, leave the employees alone, leave them right where they are. If they're going to get a 2 or 3 or 4% raise, we want them to have the full benefit of that raise.
That's right. And let me ask you one other question.
Yes.
So and this is just totally off concept, but still within the range of what we're talking about insurance. As you look at this, if we are separate from Roanoke County because we know what we're doing to manage our benefits and to try and employ you to get maximum dollar usage, can you also identify if we were separate, how that would affect? Could we be not more profitable in the insurance area, but more economical in the insurance area if we were separated totally? Because they probably need us more than we need them, I would imagine. Maybe I'm wrong, because you said the smaller groups, maybe smaller's better. I don't know.
Well, smaller in the case of y'all and the county, neither one of you are small. So you're
Right.
both big enough to be credible and run your own programs. The question is, who's driving the increases? Are the schools driving the increases? The county driving the increases? One of the first things we did was contact Anthem and said, okay, go to the underwriter and let us know who's driving the increases. Interestingly enough, we never got that answer from the underwriter. We got a renewal
That
of the
is
schools
interesting.
separate from the county. Who requested it, where that came from, I don't know. Whether that was
Very
the
interesting.
county said to separate y'all from them, I don't know.
So they did separate. Is that what you're
Y'all are
saying?
separated.
We are separated now. So we are fully functioning separately than the county.
Yes, sir. And I think that's
under the same ballooned contract though.
no. You're not separate right this minute. You will be July 1.
Okay.
You'll be
Interesting.
completely on your own.
Do they think they want to tell us that? Any chance they want, Susan? Any chance they want to tell us?
Well, I think they could see that we were trying to go that direction,
Okay.
right? And so I think they put in place the mechanisms to try and let us move forward in our own direction with our own consultant.
Okay.
Yeah. There's a huge difference if you look between what they've been able to charge premiums on the same plan that we have.
You're ahead of us.
That's just, there's something to that too.
It's what they're charging versus what we're charging.
For their employees, the premiums on the same plan. Not to chase that rabbit, but just noticing it.
All right, I'm not catching it quite as close. There's Roanoke County
Well,
government.
if you look at like a QPR 2000
Yeah.
employee owner or a family, compare that
Oh.
on the back with what our employees pay.
Okay, there you
Same thing in the
go.
middle.
There you go.
In the middle, the middle one's 2000.
Right. 9314. I got you. You're ahead of us. Shocking.
Yeah, so the numbers we have that Steve presented and the numbers in the renewal, as I said, all the claims are kind of matching up. So this is putting you on your own footing to make your own decisions going forward
Okay.
and putting y'all in a position of approving your budget and going to the Board of Supervisors and saying, here's what we need from y'all and this is why.
I guess that makes me wonder, how does that price us going forward? Have we been with them in that group? Now we're separated.
Probably if you add the two together, it'll be the same as if you're apart.
You think so?
Mm-hmm. Yeah.
So
Keep in mind that the affordable.
I just wondered if the claims being on us is the reason they wanted to separate them.
Very likely.
Probably.
Very
Yeah.
likely.
I mean, they're so sneaky. Yeah. So
But at the same time, keep in mind, y'all do go to them for money and approval, and they will have to give you, unless they want to hurt the school system, which I don't think the Board of Supervisors wants to do.
you gotta wonder with the news
I
we
would
get
hope they're
today.
not looking to hurt the kids and the employees of the
not.
school system. So hopefully they will be more than willing to help you get across on your own footing and get y'all's plan established. And then going down the road, you'll be able to make changes as you need to make changes to satisfy your employees to be in the position that you want to move your plan
Deal.
forward in a responsible manner.
Perfect.
Well, and on that note, I will let you know that we did send a letter to the chair of the Roanoke Valley Consortium that we were a part of to withdraw from the consortium today. And that's going to allow us to let Mr. Irby go out and
To market.
reprice our dental and kind of, because the dental was tied up with that consortium.
Nice.
And we paid a fee to be a part of that. And so now we will officially be out of that and moving on in our own direction for that as well.
Okay.
And I will say that the Delta representative said that would be good for the school.
That's great.
So they want to write your business, and they said it would be good for the school.
So
Unfortunately, as I said, that's not a large amount of money because you're talking about dental insurance at $40-some a person versus health insurance at $1,000 a person. So it's not as big a pot of money that you're working with there.
right.
Okay.
I remember all these problems before we had a run there.
Yeah. Well, and you know why they're able to do this.
I'll just
Yeah, no.
political statement there, but we can thank Obamacare for these high rates.
I'm going to close that out if that's okay.
We do.
But the way they're able to do this is they supplement it more. We can't. They have all that excess money that they can pay into the benefits that we can't. Yeah, absolutely. I mean, I just hope people aren't that naive.
All right, so then I'm going to get into the first thing I want to take a look at is the monthly analysis of our plans and reserves. We'll look at the health insurance plans overall, then dive into the premiums and touch base a little bit on other post-employment benefits, basically the same information I shared last year. This first chart shows last year, so count fiscal year 2025 health insurance claims and reserves by month. So if you recall, the October 2024, let me step back. So we're going from July to June, and the purple column is the revenue, so the incoming premiums. The kind of gray brownish color is or gold color is the expenditures, and then the green bar is our reserves line, right? So this is history. This is what's happened before, but I think the trend is in here for you to be able to see that on a monthly basis, right? And so last year we were in a shocking position because of that big spike in October of the claims. So then we started having to infuse cash outside of what we had planned on for the year. And we did end the year with $2.2 million in reserves. So now this year, we have run the same type of analysis, so same information going from left to right. The large revenue, if you recall, we put 2.7 or 2.7 million in as a transfer up front to infuse some money into the health insurance reserves. So that's why it's such a large chunk up front. And you can see that, through December and January, we've kind of been up and down a little bit. Now that Mr. Parsons has gotten our claims information and run out a projection for this current year, it does look like we are going to be back at a $2.2 million reserve by the end of the year. And so we do still want to continue to keep our eye on what that balance looks like. The next slide, and these are color-coded, the next couple of slides. Pink is your KeyCare PPO 1000, purple is your HealthKeepers HMO 2000, and green is your HealthKeepers HMO 3400. That includes the HSA, the other two include the HRA. There are no changes for any of these plans, so I'm not going to beleaguer reading over what all of the deductibles and everything is. But I do want to point out one thing that I learned this year. I reiterated time and time again because it was educated to me that the HSA prescription did not apply a copay until you met your deductible. However, I have learned this year that we have a plan in which if you have a prescription for a preventative medicine, you do pay the copay. You don't pay up to your deductible up front, and that's just for the preventatives. I don't know if you wanted to add anything to that.
Yeah, I think the purpose in that and the reason the ACA allowed it is it's designed to help prevent diseases which should improve claims over time. And that's why they wanted that available to the high deductible health plan so that all employees didn't have to meet the 3,400 before they were getting prescriptions covered. So that's the purpose of that. I think it's a good benefit.
So that is something that we did not necessarily, may have relayed information that was presented to us not in the best manner. And, we may have had some employees who took a look at their own medicines and strayed away from joining the HSA because they thought they were going to have more costs out of pocket. I know I looked at my cost and was like, well, that's going to really hit home hard. But then after I got into a couple of months and realized I wasn't hitting it, I had to reach out to the consultant and find out, well, why? Is there something wrong? Are they not coding us right on the... It's sad when my own pocket's saving money and I'm calling and saying, is Anthem recording this right? Because we're supposed to be charged deductible amount. So I was actually looking out for the school division using my own personal experience. So I think that's a good thing to know. The other thing to know is that with the HSA, the individuals who have that plan, their deductible, and please step in, I know I'm not going to say this exactly right, is required to be on a calendar year basis. I know one thing we want to do is move to a fiscal year basis because that makes sense since we're on a fiscal year basis for our plan. But with the HSA, it has to be a calendar year because of the IRS and the tax rules, and it's directly linked to taxes. And it affected some of our current employees because the carryover in the third quarter could not occur either. And so that was something we were not aware of up front, but we found out during the year. And we would have advertised that so people could have planned more appropriately. So that might be just one thing to keep in the back of our minds. If we change our deductible period, it may not be the same for all three plans. It may be one for the HRA and a different deductible period for the other. Am I saying that right?
I think so.
Okay.
I think so, yeah. What she is saying is the fourth quarter carryover that you were trying to give, IRS won't let you give it to your employees. Just as if we change to a plan year deductible, which I can tell you, all of our plans that we've ever set up since they started plan year deductible, we set them up plan year. So everything is, payroll deductions aren't changing in the middle of the year and all of that stuff. Everything is tracking together. That would be certainly something that would be good for you to be able to do. But we're looking into the cost of that, as I showed on this other slide, trying to figure out who does it affect and how does it affect them, because the ones under the HSA, you can't give them deductible carryover. They're going to lose something. So we've got to see what that's going to be, figure out, can we change the methodology on HRA, HSA contribution and somehow fix that so people aren't getting hurt. And I don't know that we can accomplish it.
What I heard Susan say was you could not convert an HSA to calendar year, but what I hear you saying is you can. It's just that when you convert it, they can't get their carryover.
Right now, it is calendar year with y'all.
I don't mean calendar year, I mean fiscal year.
Yeah.
The HSA, can it convert to a fiscal year or not?
It can go fiscal year, and that would be the way to have it. And then you wouldn't be worrying about carryover necessarily. It would be running with your plan. You'd run July through June, and it would work better that way.
But you're saying that if you're on an HSA, when we do convert, they would not be able to get that fourth quarter carryover.
Yeah, what's going to be happening is, what would be happening is the deductible $3,400 that they meet from now until June 30th would reset itself July 1. Right. And they'd be subject again going around with the plan. And that we want to try to be very careful and be sure we figure out how to make it work for everybody if you make that change. But going forward, if this year or next year you do make that change, then it's going to make it simpler from that point out with whatever you want to do.
So it's only a problem because we're not on fiscal year, because we're on calendar year.
That's right.
And then when we convert, it'll be, if we can convert, it'll be fixed.
Right. In other words, the fourth quarter carryover that y'all have designed that's working for the other plans, IRS won't let you give that to them. It's the simple part of it, so we don't want to mess with that. That's a problem nobody needs. So try to avoid that.
Okay.
Yes.
So then moving on to the next slide. The first several columns are the current year rate so that you can see the difference. And then we have two options. Both of these options will produce a 22.5% increase in the premiums to be able to cover the full claims cost as projected by Mr. Parsons, our actuary. The option A is a 22.5% increase to both employer and employee pieces. And you can see the monthly change for the employer in here. And I'll show you the cost of that on the next slide. And then option B would be a flat 10% increase for the employee over their current year premium. And you can see the monthly difference for that one. And then that would leave the school division to pick up the difference to get up to the 22%. So in some cases it may be a little more, some cases a little bit less. since the structures, we cover different portions of the premium. The HRA did not change in any of the instances. It is still projected to be 500, 1,000, and then 1,200, 2,400. Any thoughts or comments on that?
Yeah, it's terrible.
It is.
Keep waiting for some good news.
Yeah, it's gonna get better. Keep waiting.
I
I
wish I
don't think we
had
get
some.
good news from insurance talks ever.
I feel like I've been the bearer of bad news for a couple of years now. So this is the costing. On the left-hand side, the current year budget and what we have planned. We have the forecast in there, and so this middle column is after Mr. Parsons projected out what the full year of claims would be. We do look like we're going to have the 2.2 million in ending reserves. And then our budget for the 2027 year. So regardless of which option you choose, the total premium itself is going up 22.5%. And so the revenues it's just, are the revenues going to come from the school division or from the employee, right? And so I wanted you to see the funding costs. And I typically we only talk about the general fund, but these dollars were pretty high. And I think our grants may have to sharpen their pencils and take a look at employees who are in their grants. And that could affect them having to shift other costs to the general fund if they have to cover more of the employees, or them asking to move some of the employees back into the general fund if they can't afford it.
One thing I would like you to look at is the lowest paid person on insurance and the pay raise that we are contemplating.
Okay.
I want to know if anybody's going to lose money.
We'll look at that.
Can I ask a clarifying question? And I apologize, I'm trying to be quiet. So like in option A, that is the employee picking up what percentage of the 22.5?
They're picking up 10%.
10%.
On option A?
No option.
Oh,
Option B it is.
No option.
no, option A. Yeah, no, I'm sorry.
Is that a 50-50 split?
It's 22%, 22.5% for both pieces of the premium because the whole premium goes up.
But we're splitting the cost. Is that what you're saying?
And
The
we
increase.
didn't change our relationship of who pays what portion of the premium.
So you're keeping it the same as what it was.
Yes, but we're changing the whole premium for everybody up 22.5%.
I understand. And then option B is a 22.5% increase, but we're adjusting to where the employee doesn't pick up the same split. We're picking up more of the money, which is why it costs us more.
Correct.
Okay.
Correct.
So
We're taking on more of the cost up front. And I wonder if that may be a strategy we need to take anyway, just to get us to the point of covering more of these little big claims.
would it be accurate to assume that most of our folks are on the 2000 plan?
You know, we look at these numbers. I don't have them in front of me. I would say probably.
I think that is correct. I think it's a few more on that one. A tremendous amount on the 1,000 though.
Yeah.
Because they were there before, they didn't change.
Yeah, still there. You know, that was back to what I was saying a while ago. You know, people get somewhere and they just don't take time to look at it. And they just let it roll.
Yeah.
Well, but I think the top two plans have almost equal enrollment. I don't think it's a lot of difference between those, and the HSA doesn't have about 350 people in it, I think, right now. At 3,400, if I remember correctly. I don't have that in front of me either. Let me see if he's got it in front of him.
So then you can see the cost differential between option A and option B. The other thing I do want to point out is we did this budget right here. The second line on the revenue side, the transfer, that 2.7 million is what we put in as one-time money for the 26 year. I have it in there as a placeholder, but that's something that we need to discuss and talk about and determine, do we think we need that to continue to infuse in the reserves, or do we think we're going to need that to move back into the general fund to cover other needs that the school division has? Because we have a lot of competing needs on the priority list. We all know that. And so I think, and it doesn't have to be over nothing. We could drop that down to 1.5 million, drop it down to $1 million, right?
Does that still get us to our reserves where they need to be? What is recommended that our health reserves will be?
I'm going to let Steve, are you still on there? Can you come off mute and kind of speak?
You see what I'm saying? We
to that
infuse
effect?
that money to try to.
Yeah, I don't have the number now, but they'd certainly put you very, very close to it.
If we did infuse that money,
Yes, that's what he's saying.
Yeah.
and if we don't, we're still in danger of not having strong enough reserves.
Right. Well, you can see
That's
in
correct.
the reserves at $6.3 million for the year 27.
That's what you
which is
project.
Almost 3 months worth of claims, which is, from my perspective, the bare minimum you should have.
Well, that's what nobody's been able to tell us, so I at least appreciate that, having a number.
Yeah, I agree with Sam.
So basically, that's what your recommendation is. Like, if I have a savings account at home for unexpected whatever, it's 3 months my salary. You're saying that's 3 months worth of claims.
Yeah, you can, being self-funded, you can figure if y'all decided July 1 to leave Blue Cross and go to another carrier, you've got your Roanoke claims coming at you. And that's going to be 2.5 months or so worth of claims, and your claims are running $2 million a month. So that's a bare minimum. When I said that I would want at least that at any and all times, because otherwise you don't have a lot of flexibility to say, well, we want to go to this new carrier, but we can't pay this $6 million Roanoke. It can create a cash flow problem for you. That's just my thoughts on it.
And that's where the written funding and reserve policy that we would build with Susan and the team there. That's where we will now then have in writing, and I'm going to make this up, we want to target 25% in reserve, but we'll give a range of 20 to 30%. But if we go below 20%, we need to do something about it. And likewise, if we go over 30%, now we have a mechanism to bring that back down.
Basically, making a policy to set a minimum of what we should.
That's a good idea.
Yeah.
That way we don't think about this in the future,
Right.
where we're guessing.
Yeah, I think that's absolutely something we'll do.
Yeah.
So then this next slide, one number that we used to include, so I'll go back, is an expense in the health insurance fund was our contribution to the other post-employment benefit trust. If you remember, and for anyone new to the conversation, other post-employment benefits are basically, it's our medical plan. And we are required by Governmental Accounting Standards Board to record a liability on the books and to recognize the accrual-based liability associated with this plan. We get an actuarial report at the end of every fiscal year to be able to record this liability. And we are best practices set up a funding plan to set aside money for this. In the past, before these guys came out, this was really a pay-go type of plan. but they really have recognized that there's a lot of dollars sitting aside in these plans, and so they have encouraged all governmental agencies to not encourage, but by accounting standards, you have to record the liability. One thing that will help reduce the liability is to set aside a physical mechanism to save money for the plan. We did that by joining the VML VACO OPEB trust. And so we have an investment account set up that we, for several years, put aside $92,290 a year into to help build up the funding. If you recall, last year I brought this information to you, and we had the actuarial projection done specifically last year so that we could come up with a funding plan. We recognized that putting in the same dollar amount every year was going to tremendously overfund us. And so you can see in that first column, we would be overfunded by, the funding ratio would be 136% if we just continue to put that in forever. And although it's a small dollar amount on an annual basis, it just is a lot of cash to set aside. So in our actuarial report, we asked them to provide us best practices, what is a funding ratio to go for. And so the middle column on here was really what we found to be kind of the cheapest method to get to a 75% funding. And it entails putting additional money in for the next 5 years. And I did share this information last year, but it was one of those, you put it on the burner for talking next year. And this was something that was paid out of the health fund. I'm going to recommend that we put this in the general fund for a request this year as a tier 1 priority to put it in there so that we can set up this funding mechanism for the next several years, get the cash set aside in the trust, and then leave it there. And that is our rainy day fund for OPEB. And we kind of just set ourselves up for that. I would like to take it out of the health insurance fund because I don't want that dollar amount to start to play a factor into the claims rates. I think one of the reasons why we used down our reserves over the years is because we didn't fund this in the claims rate itself, but we did pull money out of the insurance fund to put the cash aside in the trust. And so I think it's more transparent to pull it out and put it just as a line item in the general fund. So that was just one other need for money. Any questions on that? All right, so we will kind of switch gears and move into compensation. I'd like to go over the pay plans and scales a little bit and talk about the teacher scale comparison with our neighbors, and then go over the raise. And I forgot to type in here, we also have a bonus to talk about as well. So our pay plan, for everyone who, it's really a review, Mr. Bradshaw publishes, when we adopt the budget, he publishes a pay plan. It has a teacher, librarian, school counselor pay scale. It has everybody else pay scale. It has athletic stipends, and it has academic supplements on it. And so anyone who gets paid is to be paid using this pay scale off of timesheets or in contracts. And then all personnel goes through your action to get approved. And so everything employee-wise goes through the school board. The scales are set up to have a 1.6% step between each step each year on the teacher scale. So on the teacher scale, each step represents their number of years of experience. So a teacher can clearly go from one school division to another school division and know where they land in their scale and what their income will be. On our scale, we also add an education supplement going across to the right so they can see how much that will be based off of their level of education. there is a direct relationship between the teacher scale and the non-teacher scale. During the last compensation study, they helped us realign and reset both scales so that the differential in the steps in both scales was the same. And then the teacher scale started at a point that was equivalent to where the teacher would be if they were plopped into the non-teacher scale, right? So all that being said, then you get on the non-teacher scale, and yes, we have 30 steps on that. That does not equate to years of service. It equates to a calculation of how much experience do you have. And there are very specific formulas that we use to place individuals on a step. And then when you get on that step, they proceed as everybody else does. So once you get on the step, then you proceed through like all the teachers do. But placement on the step is not like a teacher where it is exactly equal to your years of service. So I did want to share that because then just really pay scales are a part of governmental budgeting and accounting and HR. Most employers that are governments do have a pay scale in place. I think I know of one school division in all of Virginia that may have gone to pay ranges instead, but most folks use this. It is transparent. The teachers know from one year to the next what they can expect. We do stop it at a certain level, and the pay scales are intended not to add after a certain number of years, after 30 years. And in my opinion, that probably relates to the fact that they can retire at 30 years with VRS. And so it really is a career path for them to go through the scales. What we have implemented in most recent budgets, since there is desire to support our highly educated and experienced teachers, is we've been providing them a stipend of $1,000 that is one-time stipend as opposed to being a part of their VRS compensation.
Did I hear you say some of our employees stop at 30 and then some at 31 steps?
No, they all stop at the same place. I think, correct me if I'm wrong, I think the one scale has 31 and one scale has 30.
They all have 30.
They all have 30.
The difference is our teachers, if you have 0 experience, you start on step 1. So that's why we have 30 years of experience on step 30. That's not just the way we show it. Some divisions show 0 years, you're on 0. We just show 0 years, you actually start on step 1. So if you have 10 years, you're on 11. That kind of thing. So even though it says 31, it's only really 30 steps.
I'm sorry if I misspoke that. So this slide, we wanted to share a teacher comparison for ourselves and our neighbors. So this is the 2026 teacher scale comparison. Staff went out and pulled all of the teacher scales. In the first year, you can see Roanoke County is third from the bottom. In the 15th year, they are at the bottom. And then by the 30th year, we become exactly in the midpoint. Now, keep in mind, every individual school board chooses to have different approaches to their scales. Some of them choose to have the same exact percent in between every step, and you proceed through 30 steps. Some of them top out at 20. Some of them have the same dollar amount for the first 5 steps of their scale. So there are very different strategies that are involved. But I do like to share where we are in comparison.
Send a screenshot of that to our counterparts. You need to send that to them. I mean, here we are. Why would you mess with funding with the best thing going in Roanoke County? Why? It's a rhetorical question, but why would you do that? We're getting more with our people, and God bless them for what they do. And that shows the story right there.
Well, and since you're talking about that, I'm going to skip and go.
Well, while you're on that, I do think we need to look at something for the future of trying to fix that 15-year. I mean, obviously a couple $1,000s is not life changing, but I mean, if you start out at 40, almost 48, and in 15 years you're making $11,000 more, I mean, that's, I don't know, I'm not a mathematician, David, but what do you think that is? Like $700 a year raise? Like that doesn't cover inflation. Like that is
I
pathetic.
mean, God bless every teacher, but God bless Roanoke County.
And then we turn around and raise their insurance 22%.
Yeah.
And that's what I was talking about earlier. Is, I mean, the reality is we have got to do something.
I mean, do they have a concept? Do they understand?
We're going to have teachers in poverty. Is what we're going to have.
I don't.
And that's
get it.
sad.
I don't get it.
It'd be interesting to see 2% instead of 1.6 for the first 10 years, 2%, and then maybe down the last few 1.5% or whatever.
I mean, I can't imagine taking that and recruiting with it, right? Like, how do you? It's a miracle that we can recruit anybody when you're telling me that I put 15 years in your organization and I'm making less than $1,000 a year on average pay raise. That's terrible.
Mm-hmm. And we're going to give you less funding and try and get you to pull more. It just blows my mind.
There are divisions who do things like that, like Franklin County, for example. I guess they still have it. You get to your, I don't know, 14, 15, like there's this huge jump. So there are divisions who do some
play the middle years against the ending year. Yeah, you can see that.
And I think there's like, correct me if I'm wrong, but I think by the top side
They only
of
have
20.
they only have 20
So
steps.
you stay on that 20th scale forever.
Right. Which is why they go down to last place on 30 years.
Yep.
Well, that's a lot of money over the span of time.
Yeah,
that's right.
You know, but and again, getting back to your comments, I mean, we look at our placement in the state, you know, with our test scores and all that good stuff, and then this is.
You're exactly right. This says it all. I mean, this is please send from a request. You can tell them from the dingbat on the school board that he wanted you to have this bubble chart right here. They'll love it. In fact, put it in a box, wrap it up, and send it to him as a gift from Tim. That, I mean, you can't say enough to get them to understand. But it's amazing what our people do here at Roanoke County Public Schools.
Well, just because this came up 2 years ago, so the previous slide that shows how we compare with our neighbors, we've actually provided that to them. I think it was year before last, because we knew we were getting challenged on why aren't we giving the same percentage raise as the county, and that's why I wanted to point out. Well, you know, I don't think the county pay scales have that same sort of disparity than we do on the teacher side of things. I wanted them to understand that.
Well, not to just sit here and gripe. I would love to see some sort of plan that you guys can work on to try to alleviate some of this within a few years. I mean, I understand that we can't do it, you know, next year, right? But I don't know, 3 years, 5 years, some sort of plan where we can start investing more into our staff to try to fix this. Instead, I mean, because it's one thing to let them know, hey, we appreciate what you're doing and we realize you're underpaid, but we need to take some sort of action if we possibly can.
Well, we need to stop. Well, you're exactly right. But how we do that is.
And it can be a multi-year type. And I mean, different ideas, like you're saying. I mean, like you get to a certain point, you get a little bit higher raise. I don't know. You know, I do feel like that when you give everybody equal raise across the board, that does kind of keep morale where it needs to be, you know, but we need to do something to alleviate this instead of just talking about it. You guys are smarter than us when it comes to all of this. You figure out something, some way that we can fix this in a multi-year plan, and we'll see where we can get the money to do it.
But yet we're being asked to do more with less.
So that's what I was going to say. Like, there's a bucket of money, right?
Yeah, that's right.
Whether we get it from the state or the locality. And you can have low insurance rates with not quite the raise. You can have the raise with the insurance rates going up a little bit. And you can have support systems, right? You can have staff, you can have technology, you can have all that stuff. You can't have it all. Because it's like your own budget at home, right? You are limited by what you have. So at the end of the day, the only way to fix it is either get more revenue, right?
Which is out of our control.
Which we don't create.
Which we can't control.
That's right.
Or make some tough choices about the things we do. Perfect example is the Verkada bus cameras. So if we did one on every bus, it's about, Jeff, don't kill me, but it's about $520,000. So if it's about a
For 1 year.
What's that?
Is that for
a
1
year?
year? Yeah.
A year for the lease. So if a raise is about $1.5 million, by getting the bus cameras, it's like I told the principals, we got to make some choices here. Yes, it's going to make your life easier, but do we need it on every bus? So I know Jeff and Kathy in transportation ran some numbers to see, okay, let's pick our high frequency buses that have a lot of discipline and see if we can do that. And I think it came down to 100 and some odd thousand.
That's smart. Yeah.
So
that's-
doing things of that nature, you know, everybody wants highest pay raise, no insurance rates, and still have all the supports and systems we have. But because we have no taxing authority, we have no control over the budget.
And barring safety being my number one concern, obviously we want everybody's kids to come home in the same condition that they came to school in. I think everybody's main concern is that. Barring that, the infrastructure and the gadgets don't educate the kids, right?
Well,
and we all agree to that.
And I will tell you this, it's my plan with Ben when we present the strategic plan is for one of our things is to be competitive with all the divisions around us for salary. And that means that some of the choices we have to make will
Tough
be
choices because
we want to be able to compensate our people.
And that's
people fix problems, programs don't.
That's what our counterparts want us to do. You know, while they're spending, when they're flush with cash, when they're getting an extra $25 million a year on their side, and we're within the constraints of our 41% every year, and now you reduce that. I don't know about what they haven't shared that with us, but maybe at some point they'll share that with us so we can decide how we do our budget. I mean, it's a lot harder for the school system, and no, I'm not going to kiss their rear ends. I'm going to call it like I see it. So, I mean, if we could sit down, if they could have a joint meeting with us, if they were kind enough to embrace us, to have a joint meeting, I would tell it to their faces, but they won't do that. So this is the only method that it can be done in. And it's a shame. It's the one shining next to the star on Mill Mountain. We're going to have that in CTE. You know, having to fight for these things to make us a better county, it's frustrating and ridiculous. But our people are what make, and you know, I've got 5 grandkids coming through. I am thankful for every one of these teachers. But I'm telling you, it gets tougher and tougher every day to fight for you. And not because you're not worth it, but because, you know, beating our heads against the wall. So thank you for the explanation.
So we can try to work something out. I mean, I know it's not an overnight thing. You're not going to be able to present that next month, but you know, over time we can just figure this out.
I'm sorry, go ahead.
I was going to say just one more thing, maybe to restate what I think Brent was pointing out too. Like our raises aren't keeping up with cost of living and inflation. Quick numbers that I looked at. Since 2020 to 2025, we've seen an average of 26% inflation, and we're falling way behind on salary raises. So that definitely needs to be a priority that we are looking at how to close that gap. It's going to need a plan for sure.
Good point. That ought to be the minimum, shouldn't it? I mean, at least cost of living.
Yep.
Yeah, and then you're just maintaining it.
Right.
Right. So,
just at least that.
So I just wanted for anyone who has not seen the bubble chart, the famous bubble chart, the left-hand axis going up and down is actually our average of the English and Math SOL scores. Going across the bottom is the per pupil spending that is published by Virginia Department of Education. The size of the bubbles. So every school division is on this chart, and the size of the bubble itself is how big the school division is. So you can see the really huge one is going to be Fairfax, and then we are up in the top left-hand corner. This information is for fiscal year and school year 2024 because Virginia Department of Education has not published the per pupil spending for 25 yet. That won't come out until April. So we can always redo this chart in April timeframe and bring it back to you at that time.
So to clarify, some division, probably Fairfax, I guess, is what you were saying, is spending about 27 and a half per student, $27,500 per student to educate them. And look where they're at. We're spending about $16,000 a student, and look at the results we're getting. It's amazing. Again, we've got the best people in the world working in Roanoke County. It's amazing.
All right, so we'll jump back here. Running the numbers, I did present a net raise, a VRS offset, and a cost of a raise in the last work session. These numbers are going to be vastly different, and they're going to be vastly different because the last one was presented with all employees as they exist today, and so we have had 55 people join the early retirement work program, and several other folks give their intent to leave. We have converted all of those positions back to midpoint. I think Mr. Bradshaw even saved a position or two in there through his staffing exercises. And anyone who has been hired up through last Thursday, we got this last Thursday, has been placed in their appropriate place. And so this is kind of our best guess today of reality of what we will have next year. I think we still have a significant number of vacancies, and those can go either way, right? So it depends on who we hire. If we hire someone higher than midpoint, that'll cost more than what we have budgeted. If we hire someone lower, then that'll be a little bit of payroll lapse that we will save. And just to remind everyone, it is also lower. And so the net cost is the difference between what our budget is for the current year and what the budget would be under these new circumstances. Included in that is the reduction in the VRS rates. So that was not a small amount of money to go from the teacher rate being 14.21 to 12.2. And that is defined by Virginia Retirement System through their actuarial process. And that's what all employees pay. Or school divisions.
Are those percentages, does that include this step, or is that over and above the step?
That would include a step.
That includes a step.
Yes. So that is not a scale shift. That is the overall raise.
So the top number is really a 0.4% raise above the step. Is that
correct?
Right.
Okay.
Ms. Pearson, can I say something?
Please.
The scale shift is what's going to get us out of that. Some of those concerns we've talked about where you see the 15-year thing, because if you can start with new teachers hiring, you shift your scale. I agree keeping that 1.6, but if we shift the scale, that's truly what's going to help us down the road. So if we can shift the scale by, I'm at 3.4%, that's a huge scale shift, which will help that 15-year average, Mr.
So you're saying that'll bring that the middle years more?
It will absolutely help that. Yeah. It's not going to make us number one.
No, I get it. Yeah, no,
but those scale shifts are what makes a difference.
In the crossover budgets, the House did put forth a 2% raise in each year of the biennium, and the Senate put into their budget 1% over that, so they have 3% in their budget numbers for the biennium. Also, I have mentioned this before, but in the caboose budget, which is the current year budget, there is a bonus planned. This has been tweaked a little bit by the General Assembly. From what I have been able to gather, employees that exist as of 6/1/26 would be qualified for it. The minimum average is $1,500 bonus or an equivalent action, and by equivalent action would be if we could give a raise, that would be an average of $1,500 for everyone. So this is flexible in the amount, and it's flexible in the type of compensation. So we could, if we did the 2%, if we were required a 2% raise and we did a 4% raise, the caboose bonus money could help us get there. Now keep in mind, this is one-time money, so that is always disconcerting to think in that method. There is also a local match required. And we can pay it in FY26 or in FY27. So if we just took, when I provided the raise numbers, we had a FTE of 24 positions that were on that list provided to us from Human Resources. The total cost of a 1,500 bonus would be 3.7 million. The amount of money that's in the calc tool is based off of ADM, and so that ends up being 1.5 million. So our local share, if we gave that to everybody, now keep in mind, they don't say give it to everybody, but I've never seen an instance where we've not done that. And so our local cost would end up being 2.2 million. Now, this,
Right. The SOQ is what it's.
Yeah, it's based on the
Based on
SOQ,
that.
so we have a lot of
We have
above and
more,
beyond.
so we would have to.
Because you can't operate a school.
We would have to make up the cost. Is that what we're saying?
Yes,
I'm
correct.
trying to remember from last
But
year.
your number includes that, or no?
My number will be every employee gets in.
Yeah.
The
okay.
cost number, yeah.
And one thing, when we get to the house budget, there is a mechanism in which we could cover this if we pay for it next year and cover this and cover a couple other items. So we will go ahead and take a look at the state
Can I
revenue
suggest we
update.
take a break for just a little bit? I think we're 2 hours in at this point. Are you guys good with that? I'd like to call our meeting back to order. Let you proceed.
All right, we will move into the state revenue update. And I've got kind of a high level of what we're seeing at the House and Senate, and then numbers from the House. So at the House, they have the $1,500 bonus that we talked about, the 2% salary increase that we talked about. They also put in place a one-time supplement that's a flexible supplement. They will pay it in 27, and we can carry over any unused amounts to 28. So when we look at the numbers, that is a one-time only money. I put it into grant fund, and in the back of my mind, I'm thinking that can be used for the bonus. It can be used for health insurance reserves. It can be used for these other one-time needs. It's very flexible in what we can and what to use it on. But it ends up being about $4 million for us. So I'll show that to you later. They also have additional funding that they're putting towards the CISNA program for additional students. And it's my understanding that that will also help with some of the CSA programs as well. They're hoping to try and infuse some additional funding there.
That's the intention of it. I'm not really sure if it actually will. Dr. Arma, is that right?
So basically what I understand in talking to Delegate Rasul is trying to get that through to where they open up more eligibility to more kids to receive CISNA funds.
That's the key part, though.
Right, that's the key part.
There is an additional expansion of at-risk add-on to address some findings from JLARC, additional funding for school construction, the authorization of the 1% local option for the school construction, so the localities could put it on their ticket to vote for the voter referendum to charge an extra 1% for school construction. And then redirecting some of the literary fund loan money that's not being applied for to teacher retirement costs that'll help all the schools. And then at the Senate, they have the $1,500 bonus included in their recommendation. They have a 3% salary increase instead of 2%. They are recommending increasing the at-risk add-on piece, increasing the per pupil funding for infrastructure and operations piece, a K-12 sales tax adjustment, special education add-on, breakfast reimbursements, the voter referendum for the 1% optional sales tax like the House, and then additional funding for school construction. So this next slide, you've already seen the 2026 budget and the governor number. We did add the third section in here for the House Bill 30 because we were able to find the worksheet. And just to remind you, the Virginia Department of Education publishes a calculator tool after the governor's budget. Several years ago, they stopped doing that at crossover. And so when crossover occurs, which it did occur on Sunday, that means both the Senate and House are kind of done with their budget bills. They've approved them. Now they hand them over to the opposite side. So in what they published in their report on Sunday, the House had a by division breakout of the impacts. So we were able to find our numbers in that worksheet. The Senate did not include a by division worksheet, and I would never take it upon myself to try and figure out how to take it from the state level down to just little old Roanoke County Public Schools. So we've got to wait, and hopefully they'll publish a worksheet soon. Otherwise, then we just have the House bill to look at. And what we've done in the history is whichever gives us the less money is what we start to build our budget off of, because that is the conservative approach. And we'd rather be in a position to add back money if they come to an agreement in the middle and give us more money. We'd rather add money back because that's much better than trying to take it away. So in the general fund, over the variance is over the budget, not over the governor's budget. So it's over the current year budget. It went up a little bit more than what the governor had proposed. 8.7 million additional funds for the school division. In the instructional resources fund, so this is just a textbook line item, just an extra 68,000. And in the grant fund, part of the 4 million, and the majority of that 4 million relates to the one-time flexible funding that they're given to all the school divisions. So if that came down the pike, that could be very helpful for the, like I said, the bonus, maybe health reserves. You know, if we don't use it for that, maybe we could use it to buy school buses. It would just be one-time money though. So that's why I wanted to keep it in the grant fund, so we did not commingle these one-time monies with our operating money and what we look at for given raises. So then looking into the county revenue, we do have a revenue sharing agreement with the county. The first step is to take a look at ADM and population. And I've got all the calculations in here, and I'm not going to sit here and read through the calculations. I will say that the little letters kind of show how the math works, so you can work through the math. But the first part is to calculate the 3-year average between ADM and the population. And they do this on a rolling average, and they take the difference of that. Then they run that through the net allocation change and come up with, using the payroll factor and the 3-year average factor, and come up with our change to the net allocation. So that looks like it's going to be 0.99. And all of this comes directly from the county. This is a draft that we have in hand. They always preference what they provide to us is always subject to their continued budgeting process of re-estimating their revenues. And so then you come down, and the third part is they have a whole separate spreadsheet where they identify the very specific taxes, property, real estate, and various other taxes that are going to be shared. They reduce the Comprehensive Services Act, some payments to Roanoke Valley Convention and Visitor Bureaus and economic development incentives, come up with the number that they're going to apply our percentage to, and then they apply it to the base and the net increase of money. So for next year in this formula, our main transfer increase is originally drafted. It was about $3.9 million at this time. I always add on here whatever is set aside for the CSA, because they transfer us the money to us and then take it back. So just so that I have the budget in there for when they take it back, I go ahead and add it in here. It is a zero net effect for us because they do it after the transfer. So then the next chart, I wanted to share kind of a history of our transfer from 2017 through what we're budgeting at. What this shows, not only just the history of the transfer from the county, which is in the big purple shaded area. Above that is the little brown shaded area. That is the CSA costs. So you can see where that started to rise up in more recent years. The bars at the bottom, the red, they stack because they are required effort as required by Virginia Department of Education. And so the red line is required local effort, and the green on top of that is where we have kind of funds that require a local match. So these are counted differently. The match is typically on special funding, lottery funds, and then the required local effort is on SOQ. And so you can see where the county has historically provided more funding than what SOQ has required by VDOE. But we do have a great school division because we are able to spend that money appropriately. And even given that, based off of our earlier conversations, we do acknowledge that our scales aren't where we need them to be for attracting more teachers and treating our teachers right.
Not to belabor this, but just want to add 3 points real quickly based on the funding formula and what you see right here. One, our ADM, our enrollment, is factored into the formula. So in our enrollment as a percentage of the overall county population, that's built into the formula to have some sort of fairness and equity in terms of how many students are being served. It's built in. Employee numbers, that's built in, and it's kind of a proxy for our needs. I mean, we staff our schools based on what the needs are. Those staffing guidelines have not they've not gotten looser over the years based on our decline in enrollment. We don't suddenly put only 10 kids in a kindergarten class versus 18, or those guidelines have remained consistent over time. Our students are spread over 27 schools across a donut of a geography, but based, chopped up by mountains and all kinds of other geography that does not make, contiguous attendance boundaries easy to do or desirable to do, for the citizens of Roanoke County. And so, and then you go back to the bubble chart earlier in terms of our per pupil spending. We stack up pretty well. I think we're pretty frugal and good stewards of taxpayer resources, to get the bang for the buck that we do. So just want to point out those 3 things. Very grateful for the funding that we have. But if we were to only do minimum funding based on LCI, there's no way that we could educate the students of Roanoke County, certainly at a adequate level, much less at the level that we do. Thank you.
And Susan, you said our carryover from last year, what we had left was $4,544,000. Is that right? The transfer base
For health insurance?
No, like what?
Our end of year surplus.
Yes.
Some operating.
Oh gosh, I don't remember that. Probably about that, because I think we put about 800,000 in CSA, about 800,000 in minor capital, and 1.6 in major capital.
Okay.
And then we had the $2 million carryover that we always keep for emergency. So all of that added up.
Just kind of doing the math in my head. I think that's.
So now I would like to go ahead and shift gears and move back to our priority list. Like I said, I've changed the priority list a little bit to make it more streamlined for your review and consideration going forward, to be able to reference. Anything in yellow has changed from what we've had before. And some items administration had looked at have dropped off if they went back and did some more research, or were able to fund maybe a position with their own coffers, or found other ways to resolve what they needed. Our departments have taken a look at this and sharpened their pencils a little bit. So the state revenue, I should have highlighted that number because that did change a little bit. The revenue county sharing agreement of 3.8, which is subject to change. The next two items are in green because they are added in because they are money that does come in, but it also goes right back out as a similar expenditure. It's just a flow through, but to get the budget where it needs to be, we added in so that we can have the transferred balance to pay out. So the first one is the CSA costs are going up $500,000, and the second are church revenues. We have not increased our revenue for the church at Hidden Valley High School, and per our policy, the host school retains a portion, and then we allocate the rest out to all of the non-host schools quarterly. Non-resident tuition is realizing, without changing anything about the fee, just how many students are choosing to pay the tuition to come to us. We are seeing the revenue come in higher, so we want to increase that a little bit. And then fingerprinting fees that could come up a little bit based on what we're seeing. So about 3.2 million is a preliminary first look at what our revenue could possibly be. So then we'll just quickly go through each of the departments. In the Human Resources Department, the health insurance, I think this number is not the same as any of the ones that we have back in the earlier slides, because I think I didn't get a chance to get down here and change this. But whatever we decide, the general fund will cover. If we end up doing the 10% premium, then that would be the amount we would have in here. The employee raise would be to be determined. I know that is a high priority that we would like to do as much as we possibly can. There's a large number in here for EEWP. That stands for our early employee work program. We just had 55 more people added, more than what came off of the program, and a lot of higher dollar folks joining the program. And so a couple of assistant superintendents. We've had 7 bookkeepers added. So we're going to be interviewing for bookkeepers in the near future. So anyone who is watching, I should not be putting a plug. I apologize for that, but we need wonderful bookkeepers. Sorry about that. But we've just have a lot of high dollar folks that have turned over, and so for them to get paid for their days, that's that. I apologize for that. I should not have gone off rails.
Perfectly fine.
So with each of these, I did take out, since I've already shared how they relate to our strategic plan, I did take that out to streamline them, and we did add the tiers so that you could see a tier 1 would be what has been defined as really we want this. Tier 2 is we would really, really like it, but it's not we really need it. Tier 3 is it'd be nice and we want it, but it's not as important as a 2 or a 1. So that just kind of gives you an idea of our scheduling. And I just put it in here. It's not that one is higher than other. I put it in here in reverse order from largest to smallest by tier. So in administration, the church revenue is added in here because they are the ones who that whole program runs through. So that is all the money comes in, goes out to our schools. No changes for school counseling. The only change with special ed, and you won't see it in here, is that Dr. Harmon found some ways to be able to cover some of the positions that she was asking for. Elementary education, I forgot to highlight it, but the request for the assistant principals came down to 1 FTE, and so we've got one that dollar amount, and I forgot to highlight that, so I apologize.
So basically, giving 1 would allow us to have at least a part-time assistant principal at every school. That's pretty much what we would be.
And the original request had 3 of them.
The original request was 3.
So they could just split it up however the part-time hours.
Yeah, so basically it would allow, like Mason's Cove, it would give them a day or a couple of days with the part-time person, shared with a different school. Kim's gone, I can't remember her plan, but then like Clearbrook would go from a part-time to a full-time. And it's all based on enrollment and staff.
So Clearbrook shares with Back Creek.
Yeah.
So I would.
So how would that work?
I'm sorry.
What's that?
So how would that work? Right now they have a.
So probably Mount Pleasant and I was guessing.
Yeah.
Back Creek would share, and then you could share Mason Cove and Fort Lewis.
That would make more sense.
Yeah,
for example.
yeah. You're not necessarily going to share with the same people. So Kim has a plan based off of that, but I told her 3 is unrealistic.
But I'm hoping it'll be better than what we're doing now.
Yes, every building will at least have a part-time AP. Or shared AP, I guess I should say, not part-time, shared. So, which will allow, like, Mason's Cove principal to attend IEP meetings and still have somebody there for discipline and things of that nature. They'll plan those out.
So we fill that with, how would we fill that? Like, or do we already have the staff to do that?
We would hire one.
So we'd have to hire somebody that would be willing to work part-time to do that?
No, they're just sharing their time.
Right.
Okay, gotcha.
No changes for the secondary instruction, except, yeah, no changes here. The assessment and research, we reduced from 3 gifted, and I'm sorry, some of these I forgot to highlight. Reduced it from 3 gifted teachers to 1. CTE, I think the only thing here, we remove the adult ed part-time coordinator until we can get the programs in place to that would require us to have an adult ed. No changes for facilities and operations. And then under finance, I've added the $518,000 OPEB contribution, and then the CSA spending that goes with the revenue. The other thing I took off, if you recall, I had the reduction in the transfer to the health insurance fund, and so depending on what we do with that, I took it off just to leave it in the other slide. And under technology, we did add, we are under higher requirements to meet accessibility rules that are new, and this is going to expand down to our teachers and content that is on Canvas. And so our staff has gone out and found this software that will help our teachers make all the content on Canvas accessible to everyone as they need it. So that is one new item that's on this list. That's the City Labs. The other one that's on here, I put a asterisk by the Verkada cameras. And so the original request was 526, and that could go down to even as low as 100,000 a year, depending on how many buses we would put that on.
So, not to belabor this point, but this is an example where, you know, when you get the technology, you become dependent on it. And so the renewals are stuck there, right?
Right, because it's a yearly.
So those are the things, like if we wanted to try to increase raises, we got to look at what are the absolute necessities we have to operate versus what are some luxuries. So like the Verkada bus cameras, that's where we talked about the 526,000, cutting it down. Middle school vape detectors. I mean, that's just a choice on where we're gonna have to decide, because that's money we can put towards raises.
Well, that brings a good point back to your last slide with facilities and operations. I know that's something that Todd does a great job at. We got to make sure that we fund him, and I know that, you know, the buildings are aging and stuff like that. So, I'm hoping that we're giving you enough money to take care of what you need to take care of.
Well, it's like you said,
he's like, is there ever enough?
Right. But I just want it to be known that that is a concern. I mean, I know that
he does spend a lot of money out of his own budget.
But like these tubes down here, he's gonna have to eat it out of his own budget. I mean, HVAC pricing.
Well, a fire extinguisher why is that a 2? Should that not be a 1? Just
well, because I sat with Todd and did this, and with Dr. Nicely, and a 2 means it's gonna get done. He's just gonna have to take it out of some of his other budget.
Because I would think that would be like high priority. Just
I mean, I just see things that are necessities, but you know, there's really not a lot of padding there, and we got to keep that in mind too. I think that while it's nice to take on some extra things, new things, it's a priority to make sure that he's funded well. So, just making that statement.
Yep.
Well, because reality is these are all tough choices, and on the revenue side, we anticipate not getting all the revenue that we were hoping.
thought we were going to get.
Right. We anticipate a significant reduction on the local funding.
From what you're showing us today?
Yes. It could go down by as much as, I think, $2 million less, possibly.
So in that situation, like before, is that where we come up with what we what we're definitely funding, and then there's things that we would like to fund, but we won't only do those if we have the money to do them. Is that kind of what we did before?
The tier 1, tier 2, I think that's how
Yeah,
that
and
works.
then the way I'd like to do it is moving forward, if it's a tier 2, we would leave it on the list, and
But we would wait to see if we have the funding.
yeah, and then for the next year, that tier 2
Do we
could
have
still
the
be
money
on
to
the
do
list.
all of the tier 1s?
What's that?
Where-
Tier 1s are mainly like, we'd have to cut bone to get rid of some of the tier 1s. Like, we have to do the contract for
I'm
the
just asking about, like, in
custodians.
terms of what we have coming in and what we have going out. Can we afford all of the tier 1s is what I'm asking.
Well, I don't know. It depends on what the county cuts us.
I mean, based on where we
Right.
are right now.
Right now, with the dollars that are in there, I think if I remember my spreadsheet right, we had about $1 million left over to apply towards tier 2 after we took care
So
of
right
everything in
now
tier
we would
1.
be okay, but we don't know what.
But we don't think we're gonna get
Right,
that much
so then-
money.
So then we would
what?
be potentially cutting into tier 1. That's what I'm getting at.
Yes.
I'm trying to,
Yes.
okay.
But then
Possibly.
raises, that would affect how much we're able to get. So the raise, I don't know what you have in here for.
Oh, I think I have TBD.
It just says
so-
TBD, so
so
that's
I
not
have to
even,
put it in.
It's not even in.
it's not even,
So that's not even in my 1 million.
Right.
So I take that back.
so,
Sorry,
no, I mean, that, I
my
think-
formula just added up the numbers. I'm
Yeah.
sorry.
No,
You're right.
no,
Well, I mean, that's something we have to think about though.
It is.
100%.
Because that's going to take away from, depending on what we choose to do.
Which could significantly impact the ability of the division to offset the employee's cost in the health insurance.
Right, all of that is time, right?
Yep.
I know. So when do we think that we might get some more information in terms of local funding? We don't have any indication.
They have a work session tonight, so my guess would be something may come out after that work session. My guess. Let's see. So then that's really all I have, because we talked about the technology, and then I had
And like,
school board didn't change, and then the bubble chart and the maintenance schedule.
So we are presenting this. We're adopting it. Okay, I see it. 31st.
We have a lot. We've got a month. I say a lot of time, but I'll be here
doesn't
before
feel like
you
a lot of
blink.
time. Yeah. Well, we also have so many unknowns.
So we have a budget work session scheduled for March 11th, and we're hoping to have enough information to be able to provide a final recommendation. But if we need to, we also have a tentative work session set up for the 30th as well. So whatever we need to do to get you what you need so that you can be comfortable. So what do you-
Okay. Do we have any other questions or comments?
I'd like to thank gentlemen for coming and speaking to us
Yes,
about all the
and
insurance.
staying through all of this.
Yep, that's I know you have a tough subject, and and not necessarily it's not your fault. It's just you're the bearer of the news we don't want to hear, right?
I
So
understand completely.
we appreciate your work and your continued work to try to help us get through this.
Thank you.
And Susan, thank you for putting all these numbers and presentations together.
Thank you. All right. Meeting adjourned.